Body weight is defined in terms of a height to weight ratio, which needs to be between 18.5 to 24.9. Any woman having a height to weight ratio more than 24.9 is having a higher content of fatty tissue in her body. And how does that impact on the pregnancy chances? First, in IVF stimulation, we give medications to stimulate the ovaries to produce eggs. So when a person has more fatty tissue in her, even though we are pumping injections into the woman, the actual blood level of the injections or the hormones is going to be lesser because these medications get absorbed into the fatty tissue. And when the blood levels are less than normal, the ovary is going to receive less drugs, and so the number of follicles will be lesser and the growth of the follicles will also be slower. So this means that less number of eggs will be retrieved ultimately. And in IVF, it is very important to get more eggs because more eggs means more embryos and more pregnancy chances. So the number of eggs comes down when the patient is obese. Also, the quality of the egg which we observe under the microscope is poor in women who are obese. And these abnormalities in the egg carry on forward into abnormalities in the embryo, which ultimately reduces the chances of pregnancy with these embryos. It is also scientifically proven that the chromosome inside egg, which grows inside an obese woman, have higher chances of being chromosomally abnormal. And these abnormalities lead to chromosomally abnormal embryos, which never have the capacity to implant. So these are the ways in which obesity or having a higher body weight than usual impacts on the quality of the eggs, the number of eggs and the embryos. Also, when a chromosomally normal embryo is transferred to the womb of a woman, it depends upon the lining of the uterus to take up these embryos. And there comes the concept of endometrial receptivity, which is molecular level changes in the lining of the womb which helps the womb to accept the baby and grow it. And it has been shown that chemicals released from the adipose tissue or the fatty tissue are proven to impact negatively the ability of the womb to accept the embryos. So, even when we receive chromosomally normal embryos, the chances of the womb accepting these embryos is lower. The next step where it impacts is once the lady gets pregnant, the chance of miscarrying within the 3 months of pregnancy is very high for an obese lady. It is almost double that of a person with a normal body weight. The chance of miscarriage increases proportionately with the woman's age and body weight. Finally, when the baby is growing inside the womb of an obese woman, the baby is also prone for complications in pregnancy as well as in the baby. The mother is prone to develop diabetes, hypertension during pregnancy. The baby is prone to develop either growth retardation or a highly heavy baby. When a baby is heavy, there can be birth injuries during delivery. There can be complications for the baby in future life, like a tendency for the baby to get obesity in future, for the baby to get diseases like diabetes and polycystic ovaries in the future. So considering all these factors, it is ideal to optimize the body weight before we start the IVF treatment. Thank you.